Yes, speaking.
I'm checking for the prescription of the patient by the name of Regina Phil with the IC number of S5810088G.
Okay, correct.
I noticed that there was a wrong administration instruction for one of her medicines, which is the IV Recomon.
Okay.
So I would suggest changing the dates from Tuesday, Thursday, and Saturday to Monday, Wednesdays, and Fridays, as the patient is currently on dialysis at NKF Hougang on Mondays, Wednesdays, and Fridays.
Okay, sure.
For another one, the Augmentin, I realized that there was an overdose. So I would suggest changing the dosing from 625 mg 3 times a day to 625 mg once in the morning. As the patient's creatinine clearance is below 10 ml per minute, and according to treatment guidelines, the recommended dosing for Augmentin should be limited to once a day.
Okay, sure.
Okay, thank you.
Okay.
Go.
So to confirm, we will change the dosing of Augmentin from 625 mg thrice a day to once in the morning, and to change the dates for Recomon from Tuesday, Thursday, and Saturday to Mondays, Wednesdays, and Fridays.
Okay, correct.
Okay, thank you.
Bye-bye.
Hi, I'm Vicky. I'll be your pharmacy technician for today. May I verify your name?
I'm Regina Phil.
May I have the last 4 digits of your IC number?
088G.
Okay. Are you collecting the medicine for yourself?
Yes, for myself.
Is this the first time that you're taking these medicines?
Yes.
Are you? May I check if you're on any concurrent medicine or supplements?
No.
Okay. Is English comfortable for you?
Yes.
Okay. For today, the doctor has prescribed you with 4 different types of medicine. So the first one would be calcium acetate. So this one is actually to prevent bone loss. And for this one, you can take 1 tablet 3 times a day, either before or with meals. So make sure to swallow whole with a glass of water and do not chew it. So for this one, you may experience common side effects such as headache or nausea. So to help with the symptoms, you may actually take some paracetamol to relieve the symptoms. But don't worry, the side effects will improve as you get used to the medication. And if the symptoms continue to persist and it starts to bother you, do seek your doctor's advice.
Okay.
So next will be these 3 medicines. So these 3 medicines, you can take it together in the morning.
Okay.
Yeah. So for this one, it's your ferrous gluconic capsules. So this one is actually to increase your blood count. So just take 1 capsule in the morning, and it is actually better if you take it on an empty stomach before your breakfast for better absorption. But if let's say you tried it and you experience some stomach discomfort, you may take it after food.
Okay.
Yeah, so remember to take this 1 to 2 hours apart from milk or your antacids to make sure it gets better absorbed in your body. So for this one, some common side effects will include stomachache, nausea, vomiting, which may also be relieved with some paracetamol similar to the calcium acetate. So don't be alarmed if you notice black stools after you take this medication, as it is harmless. Yeah, so it's just a common side effect.
Okay.
Your gut medicine would be Augmentin. So this one is actually an antibiotic for your infection. So this one, just take 1 tablet once in the morning and make sure you finish the full course of treatment for a week. The side effects are also very similar to the first 2. So you can also take some paracetamol to relieve your symptoms. But make sure you don't take ibuprofen or anything else. Just paracetamol will be alright.
Okay.
And lastly, for this one, it's losartan. So for this one is to lower your blood pressure. So for this, you can take 1 tablet in the morning for 26 weeks. And this may cause you to experience dizziness or lightheadedness. So I would recommend you to get more rest throughout the day if you experience these symptoms. And if you were to start to notice any rashes, itchy rashes, or swollen face eyes, lips, or your tongue, do stop this medication and seek a doctor's advice immediately. So I would advise you that to manage your kidney condition, I would advise you to exercise more regularly and reduce your sodium intake. So this will also improve your diet as well. And it also helps if you practice relaxation techniques. So do you have any questions?
No.
Okay. That will be all.
Thank you. So I have all these medications and I don't know the indications of it. Could you help me why I need these medications for my condition?
Okay, sure. Okay, so for this group of medicines, your bisoprolol, furosemide, these are actually for is to manage your hypertension. So they work by lowering your blood pressure.
Okay.
Then as for these, lisinopril, dapagliflozin, E-protein beta, and lanthanum carbonate. This one is to manage your chronic kidney disease and is to improve your renal function.
Oh, okay.
Then for this one, the maltopher is actually an iron supplement to help you increase your blood count.
Okay.
Then lastly, for these two are antihistamines, loratadine and hydroxyzine. So it's actually prescribed to you for your symptoms of itching.
Oh, okay.
Yeah.
Yeah, and I also have an additional question, right? For the antihypertensives that you mentioned, I don't know why it's dosed differently on days I have dialysis and non-dialysis days.
Okay, so on the days where you have dialysis, which is Monday, Wednesday, and Friday, the doctor prescribe you with a lower dose because this is because if the doctor prescribe you with a normal dose, it may cause your blood pressure to fluctuate, and it may be tougher on your kidneys to excrete the drug after use. Yeah, so on the days where you are on dialysis, the dose is lower, and on normal days, the dose is higher.
Okay.
Yeah.
Thank you.
Thank you.